Hey, it's Dr. Chris, the detox dentist, and we are back for our Thursday live. And today I thought we would talk about the root cause of disease. And I won't need these till I start reading, but we're going to talk about the root cause of disease and how a biologic dentist actually identifies the root cause and what we do different. And then we will discuss my unique solution to how to fix this root cause without crazy, difficult, hard to understand, super expensive solutions. All right. And this is something I've done for my patients for a while now. I put together a solution that is manageable and I simplified it as much as possible so you don't have to, you know, follow such a rigid protocol that really none of us can go through. Not even me. Especially not me. I'm very simple. So number one, I'm a biologic dentist, and people see me when mostly when other dentists haven't been able to help them, when they feel that other dentists have been mostly just looking to diagnose problems and do crowns and fillings and root canals and things like that, when they felt a lack of trust with their dentist, very common. When they felt that something is not working and they did something in it, more of a second opinion situation. So a lot of patients do their research online first before they come and see me or look up a biologic dentist. It's not like, hey, Dr. Hahn is in Bozeman. Let's go see Dr. Hahn. No, no, usually I am not going to be the first person you see because you don't know anything about biodentistry yet. But I'm probably the last person you will see. So when a patient sees me, the first and foremost and the most important thing I do is I ask them how do I serve you best, because it's about you. It's about the patient. It is about why you came to seek me out in the first place, right? Sometimes it's, hey, my wife sent me to get my checkup, right? And that's great, I mean, without people to look out for us, um, things would be different. But often it's, I've been to this dentist, I'm doing a second opinion. I read something about root canals. They wanted to do root canal. I don't want it. Um, I've had a constant pain in my body. Nothing's going away. My naturopath sent me to you specifically. I've seen you on YouTube, which is great. Um, I've seen you on Instagram. I've been watching you for a couple of years now, on and on. So usually I need to know how I serve you best, because my goal is to answer your questions. My goal is to help you. I'm not here to find problems. I'm here to solve the reason you're here, right? So I listen. I sit there and I listen to your story. What have you been through? A lot of patients have been through a lot of trouble. They've been through years of pain and suffering and unexplained illnesses. They've been through naturopaths, supplements, detoxes, and so forth. They've done so many things. And I need to know what is not working. I need to know why you're here. So that is often a surprise to people. They're like, "Oh, you're not just gonna dive in and look." No, I need to know why you're here. So that's number one. Then you've already been through and had a CBCT with my staff, meaning a 3D scan, unless you brought your own 3D scan. But realistically speaking, if you haven't had a 3D scan or a CBCT and you want me to help you, I'm going to be of little use to you, because if you tie my hands and blindfold me, you may as well go see a normal dentist, right? I need to have the tools to be able to identify your problems. Now, some people come with lab tests and results, but most people just show up with minor problems and we have to find the issue, the root cause. So then we go through the CBCT scan together. I used to not show patients x-rays. They tell you as a dental student, don't show the x-rays. It's too complicated for for patients. They don't want to see x-rays. It won't sell dentistry. I'm not here to sell you on dentistry, okay? I'm here to help you understand what I see because dentistry is not rocket science. What I see, anybody can see if they know what they're looking for. So I show you the 3D scan. We go from front to back, we go from right to left, and we go from bottom and up. I show you all three views. It's fascinating to see your sinuses, to see what they look like, if they're open or closed, if your septum is deviated or not, to see if there's infections on your roots. What does a root canal even look like on an x-ray? Do you have, you know, cavitations or lesions in your bone? What does that look like? It's not rocket science. And I firmly believe most people want to know what's going on. And so I show them the x-rays really quickly. It depends on how much they want to know, but we go through the x-rays. And most of the time, it's the first time I've seen the x-rays myself. So I show them what I see. And if I see something, I'm like, all right, this and this and this, I note the problems. So when I do my exam, I know what to look for, right? So that's number one. Now, remember, we're doing a 1 hour new patient exam. You can go through some major testing, and there's some incredible biodentists that will do a thousand other things as well. And you can always do more, but I'm trying to serve the most people possible. So I'm doing a 1 hour quick cursory exam and listening to them and finding the root cause. There's way more we could do, but this is the basics. Then we have something called bite wings or the regular x-rays, the ones that you bite on. You probably have done those all your life. Those are better for detecting cavities or looking for decalcifications on your teeth. So we take a couple of those and we look to see if there is any cavities between your teeth. This tells me about your acid base balance, about your biome, and about your history, about the quality of your fillings and things like that. So we scan through that real quick. Then we mark the airway, okay? There's a way on a 3D scan to look at your airway. Specifically right here, how wide or how, good is your airway? And if the airway is compromised, we can talk about reasons why your airway may be compromised. Maybe you need a sleep test. Maybe we dive deeper into the whole airway dentistry situation, and that's fine too. That's an important thing to look at. So we identify the need for that on the CBCT scan. So now we did all that. We kind of know what's going on. You gave me a history of your challenges, if you have any allergies, any bad reactions you've had with dentists. I kind of feel like we know your history because you've told me that now. Now we're going to look at the mouth. So we put you back a little bit in the chair, and I follow a very specific, very quick, very simple protocol. I created paperwork for my staff to write this down, and we record everything via AI. And on you go. We always start just by going from upper right to the upper left to lower right, and we just call out what we see. Number one, missing. Number one, impacted. That's your furthest back upper right tooth, your wisdom tooth. Number two, filling, enamel filling, porcelain crown, metal crown, whatever, mercury filling. We go through every single tooth and we write down what kind of restoration is on the tooth and what kind of condition the tooth is in. Slight wear, no wear, medium wear, abfractions. I mean, there's so many dental terms we write down. It's for the assistant to make a note and for the AI to record. I look at the pH balance. I can tell that just by taking a metal instrument and scraping your tooth, all your teeth. And it tells me about the smoothness or hardness of your teeth. It gives me a really good idea of the pH balance of your mouth. So I make a note of that. I look at the color of your tissue. I look to see if it's red or swollen, the little points between your teeth. I look to see if those are inflamed or if they're healthy. Side note, I can always tell. I would say 99% of the time I can tell if somebody took part of the experiment. I mean, if they took the COVID vaccine. So I can tell. Reality, okay? So I can tell and I look at it and I at this point I don't even ask anymore because, you know, it is what it is. So we look at all the teeth, what's existing, what condition the tooth is in, and then we look at the bite. Then I have them bite together. We look to see how your teeth are coming together. We classify your bite. One, two, three. There's certain things we do as dentists. We classify your bite, how they function. Is it group function or is it canine rise? How far your teeth are out, how far your teeth are down. We just make notes of the current existing condition. So after I did all that, how does your mouth open? Does it move left or right? Does it open all the way? Things like that. Are your muscles tight? Then we start with your TMJ. Is your TMJ popping or clicking? Does it have crepitus, crunchy sounds in it? Does your mouth open straight? Does it go left or right again? How strong are your muscles? Is there any tenderness? Things like that. Then we do an oral cancer screening. We start up here, we move all the way down all the lymph nodes around your body, pull your tongue out, look at your tongue, sides of the tongue, underneath the tongue, look at the palate, we look all around the cheeks. It's like looking in a horse's mouth. It's kind of funny, actually. Patients love it. And we make notes of anything we see that's not right. With this, I can tell if you're a grinder or a clencher. I can tell essentially if you have acid reflux. There's a million things I can tell that all of us dentists can tell from your mouth, right? It's a window to your whole body, right? There's literally no secrets when you know somebody's mouth. So when we're all done with all of that, by the time we do this, it's literally 15, 20 minutes, it goes very fast. I'll sit back down with the patient and I usually say, I know what's going on. I know what your root causes are. I know what your problems are. And I usually do because I can tell, is it a pH problem? Is it an infection problem? I can tell what type of bacteria they have in their mouth fairly accurately. I can tell the saliva condition. I can tell the inflammation, the pocket readings, the depth that the hygienist measures, when they do their cleanings, they measure the pocket depths. We can tell all of this gives us an idea of where you're at, your starting point. And this is when we have a discussion about root cause. All right. So, in the vast majority of people, there is a biome issue, meaning you have the wrong bacteria in your mouth. You have bad bacteria. You have the bacteria that releases more acid, the aggressive ones, right? You have bacteria that lives in deeper pockets around your teeth. So if your teeth have those pockets that we measure, and it's greater than 3 millimeters, you're going to have the nasty guys in there, the ones that don't like oxygen, the anaerobes. They're just really bad bacteria. So we got to get rid of those guys. And they tend to be stronger. So they tend to multiply faster. And they cause all the havoc in your mouth. Then, if you have root canals, you're going to have infections. If you have wisdom teeth that were removed, you probably have some cavitations or bone infections. If you have impacted wisdom teeth, I've seen this a lot lately, they may be connected to the sinus. And if your sinus is filled with pus and stuff like that, it could be related to impacted old wisdom teeth that are related or into the sinus. So I know if your root cause is an infection and where it's coming from. And it probably is an infection. So if you have an infection in your mouth, most frequently around an old root canal, like almost all the time, like 90% of the time, there's an infection around an old root canal. When I see that, I know that the nastiest of nasty bacteria live in that. They get into your bloodstream, no matter how much the endodontists like to deny that. Bacteria don't sit passively around an infected tooth, they go everywhere. Research is very clear on that. So, this chronic infection affects your body dramatically. Okay, it changes your biome. All the bad bacteria in your mouth that you're swallowing all day long, hundreds of millions of them, okay, are seeding your digestive system. So if you have a problem with the biome in your mouth, you're going to have gut problems because you're going to have the wrong bacteria, the wrong biome. So I know I have to fix your biome. I can only fix your biome if I fix your mouth or the root cause or the place where these bacteria live, right? Is it gum disease? Do we need to fix that? Is it infected roots? Do we need to fix that? Is it cavitations? It doesn't matter what it is. We have to address the root cause in your mouth. Appropriately named because most of the time it's the root. of the tooth. And we do this often by removing infected teeth, literally almost daily in my practice. And I have seen too many positive results from this to let anybody tell me that there isn't a relation between an infected root canal and your overall health. Sorry, 30 years says there is. So we need to get rid of the infections in the mouth. We need to then rebuild your biome because your biome has been destroyed. You have the wrong bacteria living inside you that does everything for you, okay? You are more bacteria than humans. So if that is the bad bacteria, you're going to have bad bacteria running your body. Doesn't work out for you. So you got to fix that. We fix that by fixing the biome. That's what we're going to talk about next. So that's the beginning, right? So when the patient leaves, they know what the root cause is. They know what they can do about it. I make a big point not to tell people what to do. It is my job to give you informed consent. Meaning, if you want to have a root canal, by all means, go see an endodontist and have a root canal. You've heard my side, you've done your research, you've seen the pluses and minuses. It is your mouth. You are allowed to get a root canal. You're also allowed to pull the tooth if you want. It's not up to me. I just don't do root canals. If you want one, I'll give you an endodontist. And there's some good ones here in Bozeman, but not my first choice. So if you want to pull the tooth, I'm your guy. I'll do it a certain way. But this is one thing that we hear all the time is biologic dentists only want to pull teeth. Absolutely not. The last thing we want to do is pull a tooth. It just happens that by the time they see us, it's really the only option they have. We try to prevent this whole problem. That's what a biologic dentist does. We start with kids before they're even born by talking to the parents. Weston Price philosophy, how they eat, how they, breastfeeding and food and diet. We start at birth. So, no, we don't always want to pull teeth. But by the time everything has gone wrong for 10, 20, 30 years, we're stuck with pulling the tooth as best as possible to give you the best result without doing more harm by causing a bone infection, right? So I just happen to see people at the end of that a lot. I focus now more on fixing the whole body through the Alpha Sapien protocol that I created because I'm tired of seeing people struggle at the end of the dental career with all these infections. Anyway, so the patient leaves the practice with options. They get to decide what's best for them. Often they make appointments to get teeth removed, and we do that in a certain way. It's a different conversation. There's many videos on that I made already, and we'll have some lives on that and do some answering of questions. Now, what I did want to talk about shortly is the biome. I've noticed that there was a tremendous hole in dentistry. We did not address the biome properly. We don't give people that strong biome that they need to have less decay, to have less acid in their mouth, to seed the biome properly so their gut system gets better. So that's when I created Boss Biotics. I did this because there was a need and I created the Boss Diet. How you feed those Boss Biotics, those biome optimizing super strains, how to feed them properly so they can maximize their potency, so they work the best, right? I created this because it was necessary. It's not fun to create a new company and start over. That was a lot of work, and I don't need more work. I just want you guys to be healthier. So that's what I created. So then I realized that patients always ask me, well, what do I do? How do I fix all of this, right? Well, it's not just about pulling the teeth. That doesn't solve the problem. That solves the root cause of the beginning of the bacteria, but they're all over your body. They've destroyed your biome. They've destroyed your microbiome. Okay, they've destroyed your mitochondria, your energy source. You're tired, you're exhausted, you're gaining weight. All of this needs to be addressed. You can't just address one side, and you have to address it in a certain order to get good results. So then I had to come up with a protocol that I talked to my patients about. Like, well, I first gave them the boss diet. Here's how you eat. Protein rotation. This is what you eat. This is when you use the boss biotics. This is what you don't eat. This is what this is your lifestyle, the minimal lifestyle changes you need to make to have a healthy body. It's going to take you 2 to 3 months, right? And that evolved into, can you just can you just tell me what to do? I don't want to have to figure it out myself. So I'm like, yeah, there's many ways to skin a cat, but let me give you how I would do it if I had to do it from scratch. And that's when I developed the Alpha Sapien protocol. It stands for the best version of who you are. The Alpha Sapien, the best version of the human that you are, right? And to get there, we have to do it in certain stages. And that's the Alpha Sapien protocol. So I'm going to fly through it with you guys because I'm starting a new Alpha Sapien protocol next week. And it's the first round of cohort or people who want to learn about it because we're developing the process. So there's a opportunity to become a founding member of this new protocol to see if it works as good for you as it does for me and my family. But number one, we we need testing. We need a starting point. If I don't know where you're coming from, I can't fix it, right? I can find your root cause if I don't know what's going on. So, number one, you should see a biological dentist. You should have a CBCT scan. You should have a total tox panel test. Do you have problems with mycotoxins? Do you have problems with environmental toxins, glyphosate? Do you have problems with heavy metal toxins, mercury, things like that? You need to know these things because I can't fix what I don't know exists, right? In the ideal world, you get a Vibrant Wellness total tox test. Okay. That is what I do for my family. Number two, not two, you need to have an HSCRP test. Okay. It's a test that looks for inflammation in your body. It tells us how much inflammation is in your body. How bad is it? How many things are actually going on? And it's a simple blood test, 3 drops of blood. And you can do it through Vibrant Wellness. You can do it through some tests online. They send you a little kit. But the Vibrant Wellness test is a blood draw through your arm. It's a little more complicated. You can order one online that does it through just 3 blood drops on your finger. But you need to do that before you start the protocol. And you need to do it when you're done with the protocol. Why? Because we want to show you how much better things have gotten. We need to show you that everything you went through was for the good of your overall health, meaning less chronic inflammation. So we do these tests up front, and there's more tests you could do. Vitamin D3, we do an oxalate test. We test the function of your mitochondria. How well do your mitochondria even work? We can do gut zoomers to see if your gut biome is being fixed. But at a minimum, we want to do an HSCRP test, and I would really recommend the total tox test. That is number one. You start with that. You do your CBCT, you see a biological dentist, you identify any infections in the mouth, if there are any. And if there are any, you should really take care of those. In the protocol, we talk about when, but that's absolutely critical. And then we start the weekly protocol. Every single day, we tell you what to eat, what to take. There's a certain number of supplements we recommend. They're all given to you at a certain time to help rebuild and fix the mitochondria. There's also the boss biotics. They're designed to help rebuild your biome. We follow the boss diet. My diet, that is a protein rotation diet. It is specifically designed to give you the right foods and allow you to have a weekly fast on Fridays. You must have a weekly fast on Fridays when your gut system is empty because that's when you heal and repair. A daily fast doesn't work because you're digesting. When you're digesting, you're not fasting, you're actually working, right? So people will say, I do an 8 hour window of eating and then I fast overnight. You're not fasting. You're not eating, but you're certainly not repairing your body. You are reducing the food intake. That's good. There's pluses to that, but you're not repairing. You're not going into autophagy, meaning your body is not eating up all the bad cells. For that to happen, your digestive system must be empty and you have to give it some more time, 16, 17, 19 hours or so through the through the protocol, the Alpha Sapien protocol, we develop a weekly fast, Friday to Saturday. You can even carry to Sunday if you want. You are repairing, you are rebuilding your gut system. You're killing, well, not you're killing, you're removing all the bad cells. That only happens in the Boss diet. Then we're going to stage you. We're going to stage the supplements. And I try to minimize the supplements so you don't have to spend $1,000 a month on supplements. I think the max you would spend is $250 a month for 3 months only to rebuild your mitochondria in a certain order, right? Because you can't do it all at once. We talk about how to prepare your body so that when you are detoxing, the toxins can be taken out. You have to prepare your body. The lymph system has to be functional. So we go through very minimal things you need to do to get the lymph system to work, such as walking 30 minutes a day. It doesn't take a lot. Movement is huge for your lymph system. If you're not moving and you go from bed to car to office chair to home to dinner table to couch to bed, don't detox. It's going to cause major problems because your lymph system is not moving. You're simply going to take all those toxins and put them in corners of your body, and it's going to become worse. If you can open up the drainage pathways, right? The lymph system, the liver, the kidney, the movement, which is not hard to do, don't start a detox. Please don't do that. So we go through from day 1 to day 66 every single day exactly what to do. You're going to get an email. Here's today. This is what you do. Follow the protocol. I'm telling you exactly what to do because that's what people are asking for. It's not do this or that or here or there. No, do this exactly for 66 days and it will fix a lot of things in your life. Okay. So follow the protocol. Once a week, once a week, we have a live conversation like this on Zoom or some other platform, and I answer questions. There's a community. There's a community where you can ask questions as well to other members, to me, and we try to help you identify your unique limiting factors because everybody's going to have challenges. And you don't have to be perfect. You just have to be consistent, okay? You don't have to be perfect. So if you follow the protocol, you have questions, you ask them on the community, you have more serious questions, you can ask them on the live, on the Zooms, on Thursdays usually. I'm trying to do these on Thursdays, but I'm here to walk you through the protocol. The first protocol is 66 days, starts next week, and it's going to be just with a few people so that I can develop, the kinks, right? There's going to be kinks, but it works, right? So there you go. That is the protocol. Number 1, identify the root cause. Biologic dental exam, testing, total tox test, HSCRP, how inflamed are you? How much chronic inflammation do you have in the body? Then start the protocol. Follow through. Do 66 days. Don't give up. Continue 66 days. And after 66 days, we reevaluate and see how it went. If you joined the protocol, the guided protocol, and you did not get a drop or a better result in your HSCRP test, your chronic inflammation test, guess what? I'm going to work with you free until you do. That's how that works. I'm not here to, have you try something and send you on your way. This is a protocol designed to help you get results. If you don't get results, I'm here to get your results afterwards. Anyway, so that's what I want to talk about. New patient exam for biological dentist is critical. Number 2, going through the Alpha Sapien protocol. First cohort starts next week. Rare opportunity to become a founding member. Consider it strongly because it's closing in about 3 days. Hopefully, this was helpful. We're going to do some more videos shortly. And if you have any specific things you're interested in, let me know. I love talking about it. See you guys soon.